Urologist who practices in the New York metropolitan area, continuing my educational series of urology consults, this one on testosterone replacement therapy. Testosterone. What is it? It's a very important male sex hormone. Not just for sex, but important in a man's overall health. It's an anabolic hormone having to do with growth and development of the sex organs, body and facial hair, the larynx, Adam's apple, vocal cord thickening, voice changes, and muscle and fat distribution. It maintains our sex drive, our muscle and bone mass. Each day our bodies produce a relatively small amount, approximately 6 to 8 milligrams of this hormone in a rhythmic circadian pattern that is peaking in the early morning hours and waning in the later afternoon hours. The deficiency of testosterone has been associated with diabetes, insulin resistance, obesity, reduced muscle mass, and altered lipid profiles. So it's a very, very important hormone. Its deficiency may accelerate the process of atherosclerosis, in which fatty tissue is deposited in our arteries. As an aside, abdominal obesity in men can result in having increased amounts of an enzyme known as aromatase, which is present in adipose tissue, which converts testosterone to estrogen. We end up getting more estrogen because of the fat in our abdomen. Testosterone is primarily made by the testicles in response to release of certain hormones from the pituitary gland. LH, luteinizing hormone, is secreted by the pituitary and it causes the result of testosterone. FSH, follicle-stimulating hormone, reduced by the pituitary, causes the testicles to make sperm. It's a feedback system like our thermostats. So, testosterone deficiency. It is defined as a failure of the testicles to produce normal levels of testosterone, resulting in both physical, psychological, and sexual symptoms. It can give rise to a low sex drive known as libido. It can contribute to erectile dysfunction, sometimes even difficulty achieving orgasm, certainly reduce muscle mass and strength, increase body fat, sometimes gynecomastia, which is also known as man boobs, reduced bone density, depressed mood, irritability, decreased mental clarity at times, decreased cognition and memory. Low testosterone can cause fatigue, lack of energy, lack of vitality, and an altered sense of well-being. It can be responsible at times for anemia and has been linked, once again, to metabolic syndrome and diabetes. So, if we suspect that somebody has a low testosterone, how do we evaluate? We draw a blood sample for testosterone. It's ideal to check it first thing in the morning when testosterone is supposed to peak. We can measure total testosterone. We can also fractionate testosterone into free testosterone, which is the 2 or 3% of testosterone. That is the fraction that the body can actually use. There are two other components. Albumin binds 35 to 55% of the total testosterone. It's a weak bond. Sex hormone binding globulin binds 45 to 65% of the total. So it is the free and the albumin bound of testosterone that is the bioavailable or the active form of testosterone. If testosterone is low, we often check the luteinizing hormone and a prolactin, which are both pituitary hormones that can be responsible. As far as testosterone replacement therapy, the goal is simply to restore serum testosterone levels back to normal to treat the symptoms and signs of having low testosterone. Ideally, we would like to improve body composition. That means reduce fat, increase muscle, increase bone mineral density, improve libido, and erectile function. There are various ways to replace testosterone. For years we're using oral testosterone, however, it doesn't get absorbed properly and is toxic to the liver. IM, or intramuscular injections of testosterone, have been used for quite some time. For example, testosterone enanthanate. The problem is it needs to be given every few weeks. You get wide fluctuations in testosterone. You get massively high levels and then levels below baseline. You can get injection site reactions. This is the type of anabolic testosterone that is often used by professional athletes, or I should say is abused by professional athletes. There are gels that are very convenient, such as Androgel and Testim. This is an example of Testim. They're just little tubes that are basically opened in the morning, applied to the skin of the upper arm, and they absorb right through the skin fairly rapidly, and they work very nicely in simulating the normal biorhythm of testosterone. Just have to be careful of skin-to-skin contact, the male to his female partner. There are scrotal patches that can be used. The scrotum has a very high absorption capacity, perhaps 40% better than the skin of the arm, and there's a product called testosterone, which is basically a scrotal patch. It does and can cause some skin irritation, and some men are just not fond of having a patch. There are non-scrotal patches known as androderm. They can also cause skin irritation, and it's a visible patch as opposed to a gel, so I definitely think the gel has some benefits. There are subcutaneous pellets. There's a product called Testapel, which is good for 3 to 6 months. It's a little minor procedure necessary. It can occasionally extrude right through the skin. And there is a form of testosterone replacement that is buccal, that is having to do with the gums. It's called Striant. You put it in the inner cheek or gum. It can cause some gingivitis. It can interfere with eating, drinking, and dental hygiene. So, in my opinion, the gels are the best replacement product. As far as follow-up, once you're on these, it's important to check your testosterone. Make sure that we are in range. Not too high, not too low. Sometimes the dose needs to be adjusted or titrated. It's important to check the prostate periodically, since certainly testosterone can stimulate prostate growth. It's important to check a PSA, as you would in any adult male above the age of 40. It's important to check a blood count, because on occasion, testosterone replacement can cause the hemoglobin to go up substantially. It's worthwhile checking a lipid profile, since testosterone can affect the lipids, usually in a beneficial fashion. Side effects of testosterone can be oily skin and acne, problems seen in the adolescent whose testosterone levels have increased suddenly. On occasion, sleep apnea, occasional gynecomastia or male breast development from the conversion of testosterone to estrogen by the aromatase, occasional very high red blood cell count, that is the high hemoglobin. That could be problematic, so it's important to check that. Change in lipid profiles. Infertility. Generally, men on testosterone have sperm production that is terminated, temporarily at least. Sometimes it can result in some testicular atrophy as the testicle gets turned off. It doesn't have to produce testosterone on its own, since there is external testosterone supplied. So the testicles can sometimes get a little bit smaller from chronic testosterone replacement. And finally, one of the other potential side effects is benign enlargement of the prostate gland that may be triggered by higher levels of testosterone than previously. So that needs to be checked as well. So, in conclusion, testosterone is a very important male hormone, a number of different ways: sexual, psychological, physical, and there are many benefits to replacing testosterone if the level is subnormal. It can result in many salutary effects. For more information, you can go to our website